My name is Samuel Sane. I'm here at Kim's Hospital, and I come from Kenya, Africa, and I have a specialist, a pediatrician, and my great friend. We met early this year, and he is Dr. Babu, and I would like him to introduce himself and give his full name, and we shall continue. Welcome, doctor.
Hi. Hi. My name is Dr. Babu S. Madarkar. I'm a pediatrician and a neonatologist.
Neonatologist.
Yeah. So pediatrician is somebody who takes care of children. Children, as we know, are people from from time of birth till 18 years. That is the pediatric age group.
From 0 to 18.
18 years. In Western world, the upper limit even is taken as 21 years.
Yes.
So neonatologist is somebody who is specialized in taking care of newborn babies. So we have this distinction of neonatology and pediatrics as different, because the disease processes and the treatments required are different. So somebody who is a pediatrician, a doctor, will furthermore get trained for 3 more years to become a neonatologist. So I take care of, apart from the children, I also take care of babies who are as small as 500 grams, as small as being born at 5 months of pregnancy. So those tiny babies, we keep them in incubator and take care of them.
That is great. Let me ask you, doctor. There is what we call immunization and vaccines. At what age do you do vaccinations and immunization?
Yeah. So if I have to rephrase this question, the immunization or vaccination is something that we offer to children. It can be in the form of injection or in the form of drops. So there are a whole lot of diseases that a child will have to bear with from the time of birth till he becomes adult. So there are many of the diseases which are preventable by giving them vaccines. So there is a schedule of vaccines which we start giving. So first vaccination is given at the time of birth. First vaccination, which is comprising of anti-TB vaccine, and then hepatitis B vaccine.
Anti-TB?
Anti-TB, hepatitis B vaccine,
Hepatitis
and then
B.
polio vaccine. These are the first vaccines that we give. And then the schedule of vaccines it does start after that.
Yes.
So first one that we call at birth as 0 vaccine, and then at 6 weeks, 10 weeks and 14 weeks, and thereafter there is a schedule of events, schedule of vaccination which has to be given to parents. We give a printed format of the thing and give it to parents, and we write the dates. On those specific dates they have to come and take the vaccination.
Yes.
So over a period of time, what is happening is, with advancement of science, more and more diseases are becoming vaccine preventable. So this list is keeping on increasing every year.
Yes. Do you give a vaccine like COVID and HIV, cancer vaccines? Are there?
Yeah, with respect to COVID, with respect to HIV, with respect to the cancers, the answers are little different. The COVID vaccines we used to give for children who are more than 12 years of age, because this goes as per the guidelines given by the government, and we did give them COVID vaccines during the time of COVID. Now currently the COVID incidence, the prevalence of COVID has come down, so routinely we do not give COVID vaccinations. And with respect to HIV, the science is still in the process of making a vaccine.
Yes.
So we still do not have a vaccine against HIV. But with respect to cancers, there is something called as HPV vaccine. HPV vaccine.
What is this?
HPV vaccine is vaccine which is which was initially started to be given for cervical cancers, but now it is known that it not only helps in cervical cancer prevention, it also helps in prevention of uterine cancer, breast cancer, throat cancer, oral cancer, skin cancer, many cancers. It does help in prevention. So whether it is male or female, it is advisable to give vaccination against cancer
HPV.
of HPV from 9 years of age till 14 years of age. That is the time when we have to give 2
Yes.
doses.
Yes.
It does help in decreasing all kinds of cancer.
Wow, this is good news for our people in the world,
Yeah.
mostly in Africa.
Yeah.
Now you have been working with Kims Hospital. What is the difference between Kims Hospital and the Cuddles? Yes.
So it's something which is very different and very close to me. I take this question as very close question to me. This Cuddles is a brand, separate vertical under the name of Kims, which deals with women and child care.
Yes.
So we formed this Cuddles separately and distinctly away from Kims because the needs of women and the needs of children are completely different as compared to the needs of the adults. So I felt that we, as a patient, if I'm an adult, if I go to a hospital and then if I wait, I'm okay to wait for my illness for maybe 1 hour, 2 hours. And then if somebody asks me to go to 4th floor for a lab and 5th floor for a EEG and 6th floor for billing and then come down to ground floor to show the report, I might be okay for me.
Yes.
But if same thing is same thing has to be faced by a pregnant woman, for that matter, or a small child, or my child, if I go, I will not be happy taking my child to different places. So I'll be very happy if the services are given to my family at that point of time wherever they are.
Yes.
So with this concept that their requirements are completely different and their care is extremely emotional,
Yes.
extremely sensitive. So we have to address this sensitivity, emotional requirement,
Yes.
parallelly make sure that we offer them high quality of care. So we formed this Cuddles, which is a separate vertical, wherein we are there in separate floor and all the specialists do come to the patient rather than patient going to the specialist.
Yes.
So this comprehensiveness is what we provide in Cuddles.
Wow. This means that Kims is a big hospital, but with a special branch for mothers and children
Yeah.
to take care of them
Yeah.
at a special level.
Yes.
When I was young, I remember my mother could give me sweetened aspirin,
Yeah.
paracetamol.
Yeah.
Why do children medicine must contain sugar? Why are they sugar coated?
Yeah. It's a nice question. It's little different. We have to give the medicine, and if the medicine is bitter, the chances, the compliance, the chances that the child is going to do well
Yes.
will be good if the child takes well. And if you see amongst children, usually around 90% of children, they tend to take sweets better
Yes.
than the bitter counterparts. So which is why we tend to make them more sweeter, whether be it with medicine or sometimes we are doctors or nurses, we tend to sing songs,
Yes.
we dance in front of patients,
Yes.
we make the environment very
Wow.
friendly
Yes.
and close, and then make sure that they feel that they are not in the hospital.
Yes.
They feel homely, and then we treat.
Yes.
We don't wear aprons in the hospital. We don't show them that we are doctors. For children, especially small kids, we tend to show that we are their friends, and which is how we treat, and which is how we feel the management of any kind of illness has to happen. Only then the child will improve.
Yes. Wow, that's good. I can add on this point. Even when you go to a supermarket, you find children have got special products kept for them,
Yeah.
very well decorated to attract them.
Yeah.
Children generally are treated
Yeah.
smart.
Yeah.
Okay, let's go to this other question about rare conditions that you encounter as a doctor on treating children. Which these diseases that you have so much encountered?
Yeah. There are many diseases. I should say I am really lucky in a sense that I get a chance of treating many rare conditions. Reason being, we at Cuddles, we are tertiary care or quaternary care centers, which actually means so whole lot of area, lot of geographical area in India, and also out of India, many countries,
Yes.
where they tend to treat the patients, children and women, and they do the treatment to a certain point of time, to a certain point,
Yes.
beyond which the doctor feels the remaining part of treatment cannot be done here, and these patients have to be shifted to the next center. So we are one of those very few centers wherein we are offering treatments and therapies for all rare diseases, which is why I tend to see lot more of rare conditions, because we are counted as quaternary care center. So we have, if I have to give an example, so we have all the specialties
Yes.
in pediatrics.
Yes.
For example, a child is suffering from a condition related to heart,
Yes.
and adult suffering from related to heart, the adult patient will go to a cardiologist.
Yes.
In case of a child, he need not go to a cardiologist.
Yes.
He has to go to pediatric cardiologist.
There is a
Another
pediatric cardiologist, and another for adults
Adult
cardiologist.
cardiologist. The reason why I say so is the kind of diseases that adults suffer are completely different from rare kind of diseases that children suffer.
Okay.
So their needs have to be addressed in that specific manner. So likewise, we have all the specialties that are there in the adults
Yes.
in KIMS hospital. Same specialties, similar kind of specialties are there in Cuddles, which will deal with the children.
Yes.
So we have pediatric cardiologist, we have pediatric endocrinologist, pediatric neurologist, which is a strong team, pediatric surgery, pediatric genetics,
Yes.
and then gastroenterology, and then all lot of specialties.
Yes.
So the nature of diseases are completely different, and their mechanism, their management are completely different as compared to adult counterparts.
Yes.
So with that background, if you have to say, recently I've gone through one disease condition which is called as foregut duplication cyst.
Sorry.
Foregut duplication cyst, which actually was conditioned by birth. So wherein there was a mass kind of structure which is there in a newborn baby in the chest, which is pressing on to the heart as well as to the lungs,
Yes.
and also to the food pipe. And then child was not able to breathe, and was having issues with respect to breathing as well as heart pumping.
Yes.
So as soon as the baby was born, we shifted this baby to the operation theatre, and then we did surgery and removed that mass.
Yes.
And then subsequently baby was put on ventilator for a couple of days, and then baby improved.
Yes.
Had that thing not done immediately after birth, this baby would have worsened and died. Likewise, we have one patient now with us who is suffering from a disease condition called as congenital diaphragmatic hernia.
Repeat again, doctor.
It means it is actually congenital diaphragmatic
Congenital
diaphragmatic hernia.
diaphragmatic hernia.
What actually happens in this condition is that all the intestines they get pushed inside the chest,
Yes.
and these intestines press on the heart, press on the lungs, and they do not do the functions that they have to do.
Yes.
Pressure on the heart makes the heart to dysfunction.
Yes.
Likewise, lungs cannot expand sufficiently, and then we can even not feed these babies because the intestines are in the chest and they do not do the functions of an intestine.
Yes.
So such case we have currently. We are planning to do a surgery today, wherein we'll do a surgery and pull out the intestines from the chest, place them back to original position, and then treat the lungs for expansion and treat the heart for its good beating.
Yes.
So this is all whole lot of complex process, because as adults we can tell our problems to a doctor. If I'm a patient, I go to a doctor, I can tell my problems. Small children, they at least can cry.
Yes.
Small babies may not even cry.
Yes.
It becomes very
hard to
very
to
challenging
know the
for us to understand a problem and then treat that problem, and then make sure that the child is monitored, and make sure that the problem is solved.
Yes.
So it's really challenging for us to treat in this way for tiny patients.
Babies, yes.
So we have a couple of more patients recently, if I have to say, pediatric population, wherein child had dengue fever, but then sometimes dengue might result in many of end organ damages. Dengue can also damage brain.
Yeah.
Dengue can damage liver.
Sorry, dengue and mosquito are the same?
Yes, yeah. Dengue is caused by mosquito bite, and then sometimes, usually in the rainy seasons when the water accumulation
Yes.
is more,
The production is
the
high.
production of mosquitoes and
Is
then
high.
high is very high, which is how more and more people get this illness because of mosquito bite, which is called dengue fever.
Uh-huh.
And usually the dengue fever lasts for few days, maybe a week to 10 days, and then usually the patients do well.
Yes.
But very rarely, maybe 0.1 to 1% of the times, these dengue fever patients might have various serious issues.
Yes.
It might affect the brain, kidney, or liver,
Yeah.
and then they might become very serious. So recently we encountered one patient wherein the liver got damaged,
Yes.
as well as the kidneys got damaged, and then there was a lot of issue with regard to brain. So we had to treat this patient differently. We had to do dialysis for a child for improvement of kidney functions.
Yes.
We also did support the functions of liver, and then the child improved. So we have couple of other conditions wherein we have to give prolonged duration of ventilation. We have one very rare condition, something called as neurofibromatosis 2, wherein the muscles in this patient muscles are not functioning well.
Yes.
There is no enough strength. There is no enough strength in the muscles of the chest wall, which is why the child is not able to breathe well, and then child has been on ventilator since many months and many years. Almost the child has been on ventilator since last 13 years.
Yes.
13 years, and then child is having issues now and then, but then the child is lively, doing well, is hoping well,
Yes.
and then trying to sustain well, and that fighting spirit is the fighting spirit which is helping us to move forward.
Wow, that is great. There are conditions like cerebral palsy and
Yeah.
epilepsy.
Yeah,
They are so common.
yeah,
And also sickle cell
Yes.
in children.
Yes.
How do you handle these cases?
yeah. We have a couple of patients with epilepsies, cerebral palsies, and then couple of sickle cell disease patients. So again, I have to reiterate with the fact
Yes.
that each one of these have to be taken care by the specialist.
Yes.
So we have pediatric neurology team, which is very strong. There is one Dr. Prabjot and Dr. Jayant.
Yes.
So they have been doing great work. And again, it's not a single person's effort. It has to be a teamwork.
Teamwork,
It has to be
yes.
assisted by physiotherapist, occupational therapist, speech therapists, developmental pediatricians, and also we need to have supporting staff for doing EEGs and audiologies and visual examinations.
Yes.
So things like cerebral palsy usually result due to the damage to the brain which occurs at the time of birth, and then these children, if well taken care by this team of pediatric neurologists, doctors,
Yes.
and then the supporting staff. So if we take care of these children earlier, maybe in the first year, second year, third year, their life is going to be fine.
So they can improve
They can improve.
and get purely cured.
They can get cured to a great extent. I have experience with many of these kinds of patients, and
Yes.
who I have experience of around 20 years now, and I've seen these patients suffering a lot in their infancy or toddlerhood.
Yes.
But then now they are going to school, doing well in the school. They are able to take care of themselves.
Yes.
Some of them have become doctors. Some of them
Wow.
become engineers, and then some of them have become lawyers and administrators. So great extent of them that disease is controllable and curable.
Controllable and curable.
Curable.
So long as a parent, once he or she detects the condition,
Yeah.
should take the child to the doctor immediately.
And then
Wow.
it is not again a thing of something the child comes to the illness, you give a medication and the
Yes,
child
yes.
improves. That is not that kind of illness.
Yes.
Cerebral palsy. There has to be consistent effort from the patient's parent side.
Yes.
Parent side. At home also they need to do good amount of physiotherapy, good amount of
Physiotherapy
training.
helps a
occupational
lot.
therapy. Yeah, it helps a lot. It makes sure that child walks and runs. It makes sure that child is given right posture, and, I mean takes right posture and walks well at right point of time. All these are possible if you are able to give right therapy at right point of time. That is more important, and it has to be given by right person who's an expert.
Yes.
The pediatric neurologist or pediatric physiotherapist have to be rightly trained to take care of that illness.
Yes.
And to with respect to your second point, with respect to the epilepsies.
Epilepsy, yes.
Yeah, epilepsies is one of the most common disease conditions that we are encountering in the OPD practices as well as in our emergency scenarios, wherein patients are coming with history of seizures, fits, or patients are coming actively seizuring, fitting to our emergencies.
Yes.
And issue with the fits or seizures or epilepsy condition is that as the number of epilepsies, number of seizures increase,
yes,
so much is damage that is going to happen to the brain. It is very important for us to make sure that these children are caught in the early age group and treat them specifically so that they do not have fits or seizures, which is how their brain condition, brain growth continues.
Yes.
Otherwise, if these children are getting epilepsies frequently, the brain growth is it gets halted.
Yeah.
It doesn't grow. So there are a whole lot of protocols that we have devised, whole lot of protocols in terms of therapies and management.
Yes.
And by administering those protocols, those kinds of medical therapies, we are able to control epilepsy to a very great extent.
Yes.
And we have many large chunk of patients who are coming to our OPD follow-ups.
Yes.
And parents are really happy for the fact that their children are now epilepsy free.
Yes.
And then performing really well at the school, are able to take care of themselves very well.
Yes.
And then these things are boosting for us. I mean, these kinds of feedbacks help us to make sure that we follow the updated, newer protocols, updated, the guidelines, evidence-based practices, and high-end care, which is how we are able to make sure that these children are doing well.
Good. Doctor, there is this also issue of sickle cell.
Sickle cell, yeah. Sickle cell as a whole, sickle cell per se, it's a genetic condition. It comes because those specific genes, when the baby is being formed in mother's womb, those specific genes are malformed, which is why as the baby is delivered, this baby might have sickle cell disease. But per se, they do not suffer from any illness at the time of birth. But as they keep on growing beyond 1 year, 2 years of age, their symptoms start occurring. So, per se, sickle cell disease will not cause life-threatening condition immediately. But over a period of time, as we keep on following, they have certain manifestations. There might be injury to the spleen, injury to the lungs while breathing. But then all of these can be controlled. There are specific medications, there are specific therapies which we have to give to them. And as they keep on following regular basis to a specific doctor, all of these conditions can be kept under complete control. And then they can have a normal lifespan as any other normal person.
Is there a cure for sickle cell?
Genetically, we may not cure, but then we can make sure that their standard of life, lifestyle are as normal as any other normal being by offering certain medications during the time of illness, or making sure that the crisis doesn't happen by taking some medicines. So by giving certain medications and following them up, we can make sure that these people, sickle cell, there is no disease specific, we only treat sickle cell crisis. Sickle cell disease we don't have to treat. I mean, it's a part of the life. So they also can lead a common life. Sometimes we have something called as splenectomy. The spleen of the patient is removed because these sickle cells go into the spleen and damage the spleen, or they cause fall of hemoglobin levels. We remove the spleen and then make sure that the function of blood is maintained. That is also one of the therapies.
There is this issue of bone marrow transplant. Can it be a solution to sickle cell?
I was coming to this point. So wherein basically sickle cell is a condition wherein the normal red blood cells are spherical in nature. It is spherical in nature with the central part is thinned out.
Yes.
So this is the best way by which sickle RBC can be placed in the
Yes.
body. This is the best, which is how it folds itself as it is going through the blood vessels. So in sickle cell disease, the genetic abnormality makes this spherical cell into a spherical cell.
Yes.
And this tendency of this sickle cell is to break,
Yes.
and which is how they tend to cause blockage and fall in hemoglobin levels and rise in bilirubin levels.
Yes.
So usually if it is less in intensity, medical management is sufficient.
Yes.
But if it is high in intensity, what we do is something called as stem cell therapy.
Yes.
Or bone marrow transplantation, wherein bone marrow of normal patient is infused, and then these patients tend to produce normal cells, not the
Yes.
sickle cells.
Yes.
So that becomes a final therapy for these patients. Yeah, that those kinds of treatments also are being offered here in this hospital.
Wow, that is great. Now, doctor, to finalize our interview today, what kind of medical equipment make your work easier as a doctor?
Yeah, there are many medical equipments. We have medical equipments for diagnosing, and we have medical equipments for treating.
Yes.
So medical equipments for diagnosis include things like MRI,
Yes.
which will see usually the brain MRI or any other body MRI, or we even have PET scan, SPECT scan,
Yes.
which can identify a lesion which is as small as 0.2 millimeters, which is very tiny dot.
Yes.
Even such a small dot is also being identified.
Yes.
We have virtual imaging. If I have to say, for example, if I have to understand about the condition of the lungs
Yes.
and windpipe, what we do is something called as bronchoscope, wherein we pass a tube through the lungs
Yes.
into through the windpipe, and there is a screen which tells us the visualization that we are doing are seen on the screen.
Yes.
So this is what we go through inside. If there is any foreign body, any blockage, any mucus plug, any abnormalities, we tend to treat that part,
Yes.
either by removing the foreign body or going to. This is bronchoscope.
Yes.
There is something called as virtual bronchoscope. Just to do a CT scan, and that CT scan artificially, with its artificial intelligence,
Yes.
builds up this whole kind of structure on the screen without actually going into the lungs.
Yes.
So those are kinds of investigations that we have.
Yes.
And then with respect to the treatment, we can artificially breathe the patient. We can artificially pump patient's heart.
Yes.
We have something called as ECMO therapies, wherein patient need not breathe or need not have his heart pumping. We can artificially support both.
Yes.
So we had one patient who was suffering from something disease condition called as meconium aspiration syndrome, wherein the lungs had got completely damaged,
Yes.
and heart was also not functioning. So it needed certain amount of time for recovery of the heart functions as well as lung functions. Till that time we had to maintain body's functions.
Yes.
So we put this patient on machine called as ECMO machine. ECMO machine does artificial breathing, does artificial pumping of heart,
Yes.
both.
Both.
So it actually makes sure that patient gets 7 days, 6 days, 5 days of time for the recovery of the original organ.
Yes.
And then we can remove the patient out of this ECMO machine and continue on the routine thing. This is one. We have expertise in terms of doing organ transplants. We do pediatric kidney transplants.
Yes.
We do pediatric liver transplants. We do pediatric heart transplants, lung transplants, and then we also do pediatric bone marrow transplant.
Wow.
So which is one of the best in terms of the quality of care that we can offer, which is why we are able to call ourselves as quaternary care unit. And then we have the outcomes which are world class.
Yes.
In terms of the fact that the whatever is best is happening in the world,
Yes.
we are able to achieve that best by offering these kinds of therapies.
Here at Kim's Cuddles.
here at Kim's Cuddles.
Wow, that is great. Thank you so much, doctor, for your time. I really appreciate at least to enlighten my people, especially in Africa, and maybe any other person who is watching all over the world. I know at least something has passed and maybe you have been encouraged. Don't sit there. Make sure you talk to Dr. Babu, a good friend, a good pediatrician at Kim's Cuddles. Thank you. God bless you. Have a good time. Say hi and bye-bye to them.
Hi, thank you. It was nice speaking to you all. Hope you are all fine. Hope you continue to be fine. Thank you.
Thank you.